Part of our service here at Coastal Vets is also doing operations as well as consultations, and we're often asked about the process that people's animals will go through when they come into our care, and the bits that clients don't normally get to see. We generally ask that your pet is starved overnight from about 8 o'clock the night before, so that they can have their dinner, but no food, no midnight snacks and no breakfast in the morning. But you can always make sure they have free access to water overnight. There are exceptions to this, most notably rabbits and other small pets who we don't want to be starved at all, and they want to have free access to food all night. We'll give your pet a check in the morning, either with one of our vets or possibly one of our nurses, and this is a good opportunity for us to discuss the surgery with you and potentially any complications that could occur, and for you to ask us any questions or raise any concerns that you may have about the surgery. We'll admit your pet into our hospital. We are very lucky in that we have air conditioning throughout, particularly the dog ward. When they're recovering from anaesthetics, they're particularly susceptible to changes in temperature, so we can keep everything nice and stable. We offer all our patients a pre-anaesthetic blood test, which is a check of, in particular, liver and kidneys, and gives us a nice snapshot of their background health before we give them any anaesthetics. This is particularly useful for pets over the age of about 7, but is valid for pets of all ages. We'll often place an intravenous catheter into a vein in your pet's leg. This allows us to administer fluids and any medications that they may need, and also gives us some instant access in case of any issues that might arise, so that we can give any other medications that need to get in there quickly. Animals undergoing a general anaesthetic will usually receive an anaesthetic pre-medication. This has several advantages. It enables us to give them a small amount of sedatives so they're nice and relaxed and calm whilst they're in the hospital here, but also allows them to have some good strong painkillers on board so they're working before they're having any form of surgery done. However, the main reason we're doing this is that it allows us to reduce the dose of anaesthetic your pet needs by even up to 1/3, so it's a significant increase in safety levels. Anesthesia is induced in your pet by using an injection straight into the vein, which makes your pet go to sleep, and once it's sufficiently asleep, we'll insert a tube into the windpipe through which we can pass oxygen and anaesthetic gas, and as they breathe in, that anaesthetic gas then keeps them nice and asleep. They're monitored all the time by one of our experienced nurses, so they can make sure that their level of anaesthesia is kept at the appropriate level. And for some surgeries we might only want to keep them fairly light, such as x-rays for instance, but other things such as orthopaedic surgery we want to give them a fairly deep level of anaesthesia so that we've got as much pain relief there as possible. If your animal's undergoing a procedure which requires sterility, then we'll move your animal through into our operating theatre. We can perform a large variety of surgery here at Coastal Vets, from things like dental work, tooth extractions, routine nutrient castrates and spays, up to the more complicated orthopaedic and soft tissue procedures. Your animal recovers from anaesthesia simply by breathing out the anaesthetic gas, and as the levels drop in the bloodstream, the level of anaesthesia drops and the animal wakes up again.
Wait a moment. Good boy, well done.
Once your animal's recovered sufficiently, they can go back to bed, where again they're kept an eye on, and once they're awake enough they can have a meal, because of course they're going to be hungry if they've been starved the night before, and they can have water. And once they're up and walking, then we'll take them out, offer them a chance to go to the toilet. When your animal's ready to go home again, we'll have an appointment with one of our vets or nurses to go through the aftercare, and we'll try and give you written instructions as well. However, if you have any concerns at all, at any time, we'd always encourage you to give us a ring and ask for some advice.